The federal government released new dietary guidelines today.
They did, and those recommendations will shape the types of food schools serve, what doctors recommend to patients, and what can be purchased on food stamps. So the new chart, which brings back the old pyramid motif, but this time it's inverted. Dr. Frank McGeorge is here to kind of break down some of these changes, Doc.
Well, you know, federal data actually finds more than half of the calories that Americans are consuming come from ultra-processed foods, putting them at risk for a long list of health problems. Now, the guidelines emphasize the importance of real food that does not come from a package. Department of Agriculture update the federal dietary guidelines based on the latest research. The new guidelines echo past advice, but also include some nods to HHS Secretary Robert F. Kennedy Jr.'s Make America Healthy Again movement, urging Americans to prioritize protein and healthy fats and limit their consumption of ultra-processed foods and added sugar.
The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower health care costs.
Officials say that following the guidance can help prevent the onset or slow the rate of progression of chronic disease, as well as lower healthcare costs.
30% of healthcare costs are directly attributable to obesity.
The inverted pyramid puts meats and vegetables in the widest part at the top, flipping a long-standing visual of the American diet and moving away from the circular My Plate.
Dietary guidelines shape dozens of federal feeding programs, including Head Start. These standards affect 45 million school lunches every day.
The new guidelines also tell Americans, when adding fats to meals, to, quote, prioritize oils with essential fatty acids such as olive oil. Other options can include butter or beef tallow. Now, the updated guidelines are raising questions with some experts who worry that they put too much emphasis on red meat and dairy products. Now, the guidelines also emphasize less alcohol for better health, but eliminates the previous recommendation that men limit their intake to 2 drinks or less per day and women to 1 drink or less.
Well, we know one place where this has potential to make some changes is the school lunch program. Yeah, right. So how soon do you think we can see those changes?
So probably not very soon, actually. This is kind of a complicated process unless the administration actually speeds it up. First, the Agriculture Department actually has to use the recommendations to create specific requirements for school meals, which can take years, and then the schools actually have to implement those changes, which can also take time. So it may be quite a while before we see some effect trickle all the way down.
All right, Doc. Thank you so much.
I appreciate it.